Thank you so much, Joel, for being here. Our next presenter is the result of the Sheriff's Association's efforts for many years. Delegate Hodges put in a budget amendment 2 years ago for alternative transportation for his area. Senator Carrico got a pilot program in Southwest Virginia that lasted and funding ran out for it. And Senator Hangel was chairman of the Deeds Commission subcommittee with that I testified before many times and asked for help with transportation in mental health cases. So now we have Gail. And Gail began work in February of 2019 as the coordinator for the new alternative transportation program funded by the General Assembly. Prior to this position, she worked 25 years in various leadership positions in both private and public mental health and developmental agencies in Virginia, and most recently in Region 10 CSB in Charlottesville and the Blue Ridge Behavioral Health Care in Roanoke. She has a BS in psychology from UVA. Congratulations. Yeah, congratulations. So they're getting ready to issue a contract, and Gail is here to talk about it, and we'll probably be seeing more Gail as the contract is implemented over the next 2 years. So thank you for being there, and I appreciate very much you taking this on.
Good morning. I want to thank Mr. Jones, first of all, for his willingness to adjust this morning's schedule. I think I called him on Monday and asked if I could come, so I very much appreciate that. Okay, there is a handout coming your way. What I want to talk to you about, sort of in a brief overview kind of way, is the department's current plan for implementing alternative transportation for individuals under a temporary detention order. I hope you're seeing this as good news. First and foremost, I want to express my gratitude to each of you for the work you do each day in keeping our communities safe. I know that the legislative changes related to the ECO-TDO process in recent years have been a tremendous burden on your time and your budgets. I appreciate the advocacy that you did to encourage the General Assembly to allocate the funds that are now available for these AT services. I'm sure you're aware AT has been an option under the Virginia Code for many years. However, it was not frequently utilized due to lack of providers that could meet the requirements that the magistrates are looking for of being willing, able, and available to provide safe transport for individuals. With the bed of last resort legislation, this became even more challenging when CSB pre-screeners had to secure a TDO bed within an 8-hour time frame when an ECO was in play. Available beds are frequently many hours away from where the individual is being assessed and from their families and support systems. The burden of these unintended consequences of this legislation has been felt by all the partners in the ECO-TDO process. And while alternative transportation will not eliminate all of these challenges, my hope is it's going to alleviate some of them related to transportation, particularly for you all. In 2015, the Department of Behavioral Health supported a small pilot project that was mentioned at the Mount Rogers Community Services Board in Wytheville, Virginia. The success of that project led to where we are today. We have $2.5 million in the current fiscal year to develop this program, and $4.5 million that will be available in the next fiscal year and each year thereafter. A work group recommendation presented several ways in which AT services could be delivered across the state. Taking these recommendations into account, the department developed a request for proposals that went out in October of 2018, and several agencies responded with proposals that are currently under consideration. To date, we are awaiting a final signature of a contract with a single vendor, and I hope to have a public announcement of that. I want to say in the coming days. To be safe, I'm going to say in the coming weeks. But due to procurement regulations, that's really all I can say about that piece of it, so stay tuned. In the meantime, I've been on the job since February 25th and working to engage stakeholders that we need on board to make this program a reality. These stakeholders include you, your police counterparts, magistrates, the CSB pre-screeners, private hospitals, and our state facilities. This rollout is going to be structured and deliberately paced so that the selected vendor will have time to build infrastructure and so that we can troubleshoot areas of concern as they arise. While we intend to roll this out region by region, we recognize that the local relationships between all of these stakeholders varies tremendously and that success will be based on local implementation. Therefore, I want to ensure that we provide each locality with the necessary supports in order to be successful. I included in your handout the planned rollout schedule and a map of the CSB regions to give you an idea of where and when to expect alternative transportation to be up and running. I anticipate that this service will be fully up and running for adult transports by the end of the summer of 2020. That's about a year from now. Child and adolescent transports will follow the adult rollout and should be able to be implemented faster, is my hope, since the infrastructure will have been built by that point. So everything per the request of the General Assembly should be finalized and up and running by 2021. Per the terms of the request for proposal, when clinically appropriate, a parent or guardian will be able to ride with the child and the AT provider. The AT provider will transport the parent or guardian back to their home locality once the child or adolescent is settled into their TDO location. And I know for a fact from my work in the Roanoke area that of all the transports that you do, children and geriatric individuals are usually some of the most challenging and the most heart-wrenching. This program will hopefully eliminate some of those challenges. Our overall goal is that AT will eventually transport 50% of all TDOs statewide. Based on fiscal year 2018 data, this would be just over 12,000 transports per fiscal year. So you all have been doing just over 25,000 in a year. So if you feel tired this morning, there's a reason. Fiscal year 19 data is tracking closely as far as the number of TDOs to fiscal year 18, so we feel like this 12,000 transports for AT a year is a pretty good estimate. We will monitor this closely and be collecting data continuously to assess utilization and troubleshoot problems if that 50% goal is not being reached. Should more than 50% of TDO transports be done by AT, we would most likely have to go back to the General Assembly for additional resources, which would be a good problem to have. There will be continued need for law enforcement to do some percentage of transports for individuals with certain risk factors, things like extreme self-harm, aggression, or flight risk. Per the terms of the contract, the AT provider will not be using restraints. However, the vehicles will be secure and have safety protection built in to reduce risk to both the driver and the individual. Drivers will be extensively trained to work with individuals in a mental health crisis. The hope is to destigmatize the means of transport and reduce trauma to individuals who have, in most cases, already faced untold trauma in their lives, making it difficult to seek and comply with treatment. If the TDO process can be recovery-oriented, the hope is that it will encourage individuals to seek treatment voluntarily and to engage in continued treatment moving forward, eliminating the need for law enforcement transport. In order to ensure that we engage each of your localities in this planning process, you can expect to hear from your local community services boards and from me in the coming months. You will each be invited to local stakeholder meetings that will begin in June in Region 3, and that's that far southwest part of Virginia. We chose to begin there partly because that's where the pilot was, and also because they have the highest number of TDOs in the state in that area, and partly too they have fewer hospital resources. So your transports are not only more, but they're longer and further away. We will be requesting that at least we have one representative from each region to represent sheriff's offices and interests on a regional quality council that will oversee this program in each region. We want and need this program to work, and we've got to have your input. This is a really broad overview that I've given you today. I needed to be brief so you can move on with the rest of your agenda today. If we have time, I'm willing to answer any questions. Yes, so he was asking, he's saying he's assuming the processes about how we'll do transfer of custody and those kinds of things will be worked out in the councils. They will. Protocols came out of the pilot project. I am reviewing those protocols. I think they need a little bit more specifics in them, particularly related to things like individuals who are intoxicated and how the CSB pre-screeners will assess for AT. I will tell you that the assumption that the pre-screeners will be taught is that you will use alternative transportation unless someone meets a checklist of criteria. So we want this to be a rule out, not a rule in. The assumption is you will use AT. Yes, absolutely. So medical screening is probably where the most holdups happen and where we run over that 8-hour ECO timeframe, as you all are well aware. So yes, that will be included in the protocols. The vendor who is signed on will have a 2-hour time frame in order to respond once it's determined that the TDO location has been set, and they will have 2 hours max to get to the location to pick up the person for transfer of custody. That is the intent, yes, not to have to call someone back in. I think those are the exact cases that we want to avoid you all having to transport, and I think that's the beauty. I think I've heard of those in the Roanoke area. I think we even had a 3-year-old at one point. So, yeah, it's sort of unthinkable, and I'm really pleased that we'll be able to work with those families and children in a way that's a little bit different than you all have constraints that you have to abide by, and I think this will be exciting. So you're welcome. All right, thank you very much. You have my contact information, so feel free to call me.